The purpose of this video is to serve as an introduction to liver disorders and to examine the disorder of hepatitis, including the types of viral hepatitis. We are first going to take a moment and examine the functions of the liver. The best way to make sense of what you're looking at with the disorder is to think about the purpose of that organ or body part, and then think about what happens when that body part no longer works. We are then going to have a brief overview of what hepatitis is and the variety of causes of hepatitis. We will then review viral causes of hepatitis, followed by the pathophysiology of a viral hepatitis, clinical manifestations, phases of hepatitis infections, and management of hepatitis, including nursing care of the client with hepatitis. First, let's examine the anatomy of the liver and biliary system. The liver is located in the right upper quadrant of the abdomen, and with the body of the pancreas extending into the left upper quadrant. The organs in the liver and biliary system, the liver, the gallbladder, and the pancreas all assist in normal digestive processes. The liver also has many other functions, which we will examine on the next slide. Please take note of the ducts that connect to the liver and pancreas, as stones from the gallbladder can get caught here and cause problems for both the liver and the pancreas. I have a worksheet I call, "What has your liver done for you lately?" The answer to that question is quite a lot. Let's take a moment and look at all the things that the liver does for you. The liver is involved in metabolism of proteins, fats, and carbohydrates. The liver also metabolizes steroid hormones and most drugs. An example of a hormone that is metabolized in the liver is aldosterone. Imagine what would happen if you have an excess of aldosterone in the body. There are also enzymatic systems within the liver that will process medications and metabolize medications. The liver is responsible for production of plasma proteins like albumin, and you know that albumin is part of what maintains colloidal osmotic pressure in the blood vessels. Also, just about all clotting factors are manufactured in the liver. So if your liver's not working, what happens to your clotting factors? Think about that. The liver conjugates bilirubin from a fat-soluble to a water-soluble form, which is then able to be excreted. The liver detoxifies toxic substances such as alcohol. Think about what drugs are also toxic to the liver. Ammonia, which is a byproduct of protein metabolism, is converted to urea in the liver and eliminated by the kidneys. Bile is essential for absorbing fats and eliminating bilirubin from the body. The liver produces that. The liver manufactures cholesterol, and that is why statins work in the liver to decrease LDL production. Meanwhile, the liver is also a storage facility. It stores glucose in the form of glycogen, it stores minerals, and it stores your fat-soluble vitamins. So if the liver is not able to store these things, you may have a deficiency of some of these substances. Other functions not mentioned here, but still important, the liver produces thrombopoietin, which stimulates the production of platelets. And there's something called Kupffer cells, Kupffer, and they're a type of macrophage in your immune system that are in the lining of the sinusoids, and they phagocytize foreign cells and damaged blood cells. So they're kind of is like a cleanup crew within the liver to help the immune system. When you consider disorders of the liver, you will generally see disorders related to 3 different pathologies. You can have disorders related to infectious organisms, which we're going to talk about here. You can also have a disorder of the liver related to exposure to a toxic substance. So let's think about what substances are toxic to the liver. Automatically you think about ethanol or alcohol. That is one that, especially over a long period of time or in large quantities, can be very, very toxic to the liver. There's also certain medications such as acetaminophen or Tylenol, methotrexate, and even diclofenac, which is also known as Voltaren. Finally, malignancies. The liver can be a primary site for cancer or a location for metastasis from a cancer from another part of the body, like the colon or the breast. Hepatitis is simply defined as inflammation of the liver. If you look at medical terminology, itis is a medical terminology for inflammation. So As per the name, it is inflammation of the liver. It can have acute or chronic forms, and it can have a variety of causes. So we're going to really dial in on the viral causes, but it can also be a bacterial hepatitis. It can be related to metabolic disorders such as hereditary metabolic, which lead to accumulation of certain substances like hemochromatosis, which is an excess of iron in the blood, can cause hepatitis. You can have drugs or alcohol or other toxic substances that can cause hepatitis. Also, there's an autoimmune form of hepatitis that may be associated to another autoimmune disorders that can cause an inflammation in the liver. Think about lupus, where you have localized inflammation from those antigen antibody complexes. We're going to look a little bit more closely at the viral causes of hepatitis, conveniently named hepatitis A through hepatitis E. Hepatitis A is known as a self-limiting viral infection, meaning that it occurs, it kind of does what it's going to do, and then it moves on. Okay, symptoms for hepatitis A infection are also often nonspecific and mild, maybe flu-like in symptomatology. Usually with a hepatitis A infection, there's no long-term damage, and they don't think that you develop a chronic or carrier state with hepatitis A, but it's really unknown. Transmission of a hepatitis A infection is a fecal-oral route. Okay, and that's kind of gross to think about, but somebody who has hepatitis A, who uses the restroom and maybe doesn't wash their hands afterwards, may be at risk of passing on the pathogen. Okay, it also mentions sexual contact with an infected person. Generally, the thing you want to think about is fecal-oral for hepatitis A, though. It has an incubation period of 2 to 6 weeks, and they look at anti-HAV antibodies. So if you're caring for a patient and they have anti-HAV antibodies and they're positive, it means that they have exposure to hepatitis A at some point. Prevention of hepatitis A involves using boiled or bottled water, obviously enforcing good hand washing. If you're giving somebody produce, peeling fruits and vegetables and washing them. Okay, and if you're sharing a house or a residence with someone with hepatitis A, being very careful about not sharing utensils with somebody who's infected. Hepatitis B virus, okay, it's a DNA virus which replicates in the liver. Okay, this is a nice to know, not a need to know. There's something called a Dane particle. It's the infectious component of the hepatitis B virus, and HVAG and HBA are the antibodies that they may test for to see if you've had exposure to hepatitis B. After a hepatitis B infection, you may develop an asymptomatic carrier state and or a chronic active state. Patients with hepatitis B infection may be at risk for cirrhosis and liver failure, and also an increased risk for liver cancer. Remember, chronic inflammatory disorders can increase the risk for cancer occurring in that organ or body part. The hepatitis B virus is found in blood, semen, cervical secretions, saliva, and wound drainage. Transmission of the hepatitis B virus is generally direct blood-borne contact, direct or sexual contact, contact with a contaminated object. For example, if somebody has a drug use disorder or a substance use disorder and they're sharing needles, contact of the needle of somebody who has hepatitis B is going to transmit the virus, or it also can be transmitted mother to fetus. High-risk groups for contracting hepatitis B, certainly healthcare workers if you suffer a needle stick from somebody who has an infection. IV drug users that are sharing needles. Okay, also through sexual contact. So this mentions homosexual men. It could be people with sex partners using unprotected sex. It can be transmitted through sexual contact. The incubation period is long, 6 weeks to 6 months, and there are vaccines available, so it is a preventable disorder. The hepatitis Z virus is a virus known as a flavivirus, and all you really need to know is a flavivirus is a type of virus. Okay, its incubation period is 5 to 12 weeks. It has a high rate of chronic infections. Okay, so if you have a hepatitis C infection, chances are you're going to end up with a chronic infection. Okay, there are 6 different types of hepatitis C infection. It's found in blood products, and in transplanted tissue, which has implications for somebody if they want an organ or tissue transplant, that they're going to need to check and see if that donor is infected with hepatitis C. It can be sexually transmitted. IV drug use, however, is the most common route of transmission in the United States. Hepatitis V is something called a delta virus. Okay? It's an RNA virus, okay, and it requires a co-infection with a hepatitis B infection for it to replicate. The incubation period for hepatitis D virus is 3 to 13 weeks. Transmission is going to be the same as hepatitis B, with a high rate of incidence in IV drug users, and hepatitis B vaccine is used here also as a preventative measure. Last but not least, we have the hepatitis E virus, an RNA virus with an incubation period of 3 to 6 weeks, a fecal to oral route of transmission with similar clinical manifestations to hepatitis A virus. For pregnant women with a hepatitis E virus, they may have a higher mortality rate, and you may see this endemic in other countries like Southeast Asia, India, North Africa, or Mexico. So let's move on to pathophysiology of a viral and hepatitis infection. Okay, the infection causes the inflammatory response. When you have inflammation, you know you have vasodilation, you have increased capillary permeability, and fluid will shift out of the capillaries into the interstitial tissues, causing inflammation or swelling of the tissues. That edema will eventually, in the liver, will cause bile obstruction and cause obstructive jaundice, which is going to lead to some of the signs and symptoms we're going to see in somebody with a hepatitis infection. It is a cell-mediated immune response which damages hepatocytes and Kupffer cells, causing hyperplasia, necrosis, and cellular regeneration. Okay, you can have scarring in the liver secondary to a hepatitis infection. So you may come out of the infection having long-term consequences to that infection. Generally, if somebody has a milder form of hepatitis, there's going to be little parenchymal damage or little damage to the liver. For hepatitis B and C infections, you're more likely to see more severe liver inflammation and damage. And something called acute fulminating, sudden and severe hepatitis that can lead to liver failure. I feel like I've seen patients come in with acetaminophen overdoses that develop acute fulminating hepatitis, which leads to liver failure. The liver does have regeneration capabilities, but scarring can interfere long-term with liver function. So once that tissue is scarred, it's not going to be able to regenerate. Asymptomatic carriers of hepatitis B and hepatitis C also have an increased risk for developing hepatocellular carcinoma or liver cancer. Hepatitis B and hepatitis C can lead to chronic infection. And when we talk about cirrhosis, one of the causes of cirrhosis can be a chronic infection of either a hepatitis B or C virus. There's 3 main phases for the clinical manifestations of a hepatitis infection, and we're going to talk about them. The 3 phases are called the prodromal, the icteric, and the convalescent phase. Prodromal phase is what they call insidious or rapid onset. So because this is a virus, I always like to say you get kind of a viral syndrome, and you know when you're coming down with a virus and you start to not feel well. You get flu-like symptoms, okay? You may run a low-grade temperature, you start having muscle aches and pains, aches in your bones, fatigue, okay? You may end up with nausea and vomiting, okay? You may also start to develop right upper quadrant or epigastric pain. Think anatomically about the location of the liver and why you might have pain in that area. Generally, it develops about 2 weeks after exposure or after that incubation period, okay? And you may have a mild but chronic abdominal pain. Then you have your icteric phase. Icterus is a term describing jaundice. So it's kind of an old school term. You can say, for example, if you look at this gentleman in the picture, okay, you would say his sclera are icteric, meaning that he has jaundice to his sclera. Okay, onset of jaundice is approximately 5 to 10 days after the initial symptoms manifest. Okay, you're going to have dark urine because of increased levels of conjugated bilirubin, and oftentimes the stools are going to be clay colored because normally bile can be released or bilirubin can be released in the stool, and it's not going to be. Oftentimes patients may need hospitalization during this phase of hepatitis. And then the convalescent phase is much like the name implies. Okay, it's when the symptoms start to subside after 2 to 3 weeks of acute illness. The patient will have an increased sense of well-being and energy level. They're going to start to feel better. They're going to have an increased appetite. The jaundice and the abdominal pain are going to disappear. Okay, if it's hepatitis A, it's going to resolve in about 9 to 10 weeks, whereas hepatitis B is going to take about 16 weeks to resolve. If we move to lab and diagnostics, okay, think about liver enzymes. First of all, you would think about some of the things that the liver does, and you're going to see changes in all of those labs. But when we're looking at specifically liver damage, we're going to look to see, are the enzymes that the liver producing, are they elevated? So you're going to look at your alanine aminotransferase, aspartate aminotransferase or AST, alkaline phosphatase or ALP, okay, your GGT, LDH. Okay, the serum bilirubin also, it's going to tell you, are your bilirubin levels high or low? And they may do a liver biopsy if they want to take a look at the liver tissue. Another big test that you may see, and I think it's probably the most common test I've seen besides liver enzymes, is a test for evidence of antigens or antibodies in the blood. So you may see an anti-HAV or an anti-HBV type antibody or an HCV to see if the patient has antigen or antibodies to these viruses. When we're discussing medical management of a client with viral hepatitis, think about initially identifying the cause of the inflammation, treatment of symptoms, because remember, most of these viral infections, other than antivirals, you're probably going to end up just supporting the patient until they move past that acute icteric phase. Monitor liver enzymes and bilirubin levels for liver damage, and support the liver's ability to regenerate. Okay, nearly all individuals with acute viral hepatitis will recover without pharmacologic treatment. There are vaccines for hepatitis A and hepatitis B for high-risk groups. Okay, post-exposure with Hep A and Hep B, they also can give you immune globulins, so they can give you some antibodies to help fight it. To prevent chronic hepatitis C infections, you can give interferons, which are monoclonal antibodies, or you can give an antiviral like ribavirin. Okay, interferons have antiviral, immunosuppressant, and anti-neoplastic activities. Okay, so they may help to block the virus from entering the liver. Some more practical things for medical management. Avoid using pain medications toxic to the liver. So this is not going to be a patient you're going to be wanting to give acetaminophen to. Certainly maintenance of good nutrition. Remember, there's a lot of digestive and nutrition related functions of the liver. So it's going to be important to support liver function. It's going to be support nutrition because you need to make sure the patient has the best healing capability. Certainly avoidance of alcohol and diet drinks. Diet drinks don't have really any dietary or nutritional value. So generally you're going to focus caloric intake on high quality calories rather than diet drinks. Hygiene that relieves pruritic symptoms. Think about warm but not hot water for bathing, mild or no soap, okay, and using an alcohol-free lotion. Generally, standard body precautions are going to be what you need to use. And another big thing is providing the patient with adequate rest periods throughout the day. There are some complementary therapies that might be used. Okay, milk thistle has been shown in several studies that it can protect the liver from toxins. Licorice root can also alleviate liver toxicity. It's anti-cancer and anti-inflammatory. However, the complementary therapies are not without their side effects. So it's important if a client is using complementary therapies to be aware that there are side effects to that. Nursing management of the patient with hepatitis involves supportive measures. So you're going to use measures to promote comfort and manage fatigue. So think about spacing out activities. Okay, a common answer I always hear is clustering care. We don't want to cluster care because that means going in and doing everything at once. That's going to exhaust your patient, so you want to space out activities. You want to encourage a healthy diet, approximately 16 carbohydrate kilocalories per kilogram per weight per day. Encourage prophylactic treatment of all members of the patient's household. So if there's a vaccine, the patient has a chronic infection, they're going to possibly want to look at prophylactic treatment. Do not share eating utensils, and you would educate the members of the household to avoid food handling and preparation, especially for the ones that are fecal or oral, and to abstain from sexual relations during an acute infection. Thank you very much for your time and attention. This concludes this lesson.